Hello, this is Madison Crosswhite, and I will be going through a presentation as well as reading a script written by myself, Marisa, Logan, and Elizabeth. And our presentation is on sickle cell, more specifically sickle cell disease. A general overview. Sickle cell anemia is a rare disease. It is inherited from past generations and will be present in the baby's genes. This disease affects the red blood cells and makes them look similar to a crescent moon after they have been affected. This presentation covers how it is diagnosed, the symptoms, the treatment, the prognosis, and the social issues with sickle cell. Diagnosis: how and when. If a person has sickle cell disease, it is present at birth, but most newborns do not have any problems from the disease until they are about 5 or 6 months of age. Your doctor may use a number of tests to diagnose sickle cell disease if you may have the condition. People who do not know whether they make abnormal hemoglobin can find out by having their blood tested in a screening test. This way, they can learn whether they carry a gene for an abnormal hemoglobin that they could pass on to a child. In newborn screening programs, blood from a heel prick is collected in spots on a special paper. The hemoglobin from this blood is then analyzed in special labs. Doctors can also diagnose sickle cell disease before a baby is born using a sample of amniotic fluid or of some tissue taken from the placenta. Testing before birth can be done as early as 8 weeks into the pregnancy. Oh God. Hold on, my screen is frozen. Okay, sorry. Symptoms. Over time, a person may experience symptoms depending on how sickle cell disease affects their health. The symptoms of sickle cell disease can vary from person to person, and they can also change over time. A yellowish color of the skin, known as jaundice, or whites of the eyes, known as icterus, are both symptoms of sickle cell disease, as well as fatigue or fussiness from anemia, or painful swelling of the hands and feet, known as dactylitis. Complications of sickle cell disease include chronic pain, delayed growth and puberty, heart problems, stroke, or silent brain injury. People who have sickle cell disease usually also have mild to moderate anemia. However, at times, they can have severe anemia, which can be life-threatening. We get to wait now. I just loaded it, so my bad.
In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme pain.
The blocked blood flow through the body, I'm going to say that again. The blocked blood flow through the body can lead to other serious problems, including stroke, eye problems, infections, and episodes of pain, called pain crises. Having sickle cell disease also raises your risk for severe illness from COVID-19. No, thank you. Treatment. Treatment of this disease most commonly focuses on managing the symptoms of the disease rather than curing it, which most often includes pain management and preventing other complications from resulting from the disease to arise. Treatment often includes blood transfusions or different medications. Some common medications for sickle cell are hydroxyura, which reduces the number of painful crises that can also diminish the need for blood transfusions. L-glutamine oral powder, which works to lessen painful events, and crizanlizumab, which was recently approved by the FDA and once again lowers the number of painful crises. Common painkillers are often frequently used to be given to patients with this disease. In some cases, however, a stem cell transplant can be done to cure the disorder. While this is still rare and is currently only done exclusively on a small number of children and teenagers, this transplant could become much more common as the medical field continues to learn about how to effectively use stem cell treatments. Oh my gosh, why does this always happen? There we go. The average life expectancy of a patient with sickle cell is overall lower than someone who is not affected. A study done in 2019 found that the average lifespan of someone with this disease is 54 years. According to studies, only around 50% of affected individuals lived to age 50. Studies have found that the majority of childhood deaths due to the disorder occur within the first 2 years of the child's life. Social issues. Oh, I'm a mess today. Okay. Those with SCA cannot overexert themselves. This can be challenging for children with this illness because they cannot perform activities like their peers can. Students who constantly need to leave the class to use the restroom or receive care from the nurse may result in them missing out on things happening in the classroom. Adults may feel as if they cannot live a normal life, and may even fear having children of their own due to them being positive for SCA. Ricky was 3 years old when his family found out he had sickle cell disease. His mother, Lamerda, claims they faced many challenges when Ricky started school. I try to let him live the life of a life a child wants to live, inclusive of any activities that he finds interest in. He just may have to make some adjustments and/or accommodations for SCD. As an infant, Aaron was diagnosed with SCD. Having sickle cell disease nearly killed Aaron. She experienced one devastating medical complication after another. She had to walk to school with an oxygen tank because she couldn't breathe very well, and got picked on by her peers who called her names. I was a bully's paradise, she states in an interview. Alright, so that is our whole presentation. Thank you for bearing with me. This is my one and only take, so